but we'll get started with an intro of who you are and how you got into chiropractic.
Oh, thank you so much for allowing me to be here. I'm Dr. Jiana Lanza. I'm a chiropractor. Love chiropractic. When I got into it, I wasn't really aware of the impact of chiropractic and it being nervous system based. So I just enjoyed the gym. I found the gym when I was 16, started driving, found my way to the gym, and then really understood how the body is so much more than I can really imagine. And then going into my bachelor's program is when I found exercise science. So FGCU is where I went. I wanted to go further with that. Biomechanics of the body is really drew my attention in. And so during my internship at FGCU the last few months, I found a yoga instructor, and she really pushed me to look into chiropractic to see if that's an avenue that I found interest in. And I was like, let's just see how it goes. Applied to it, got in, and it just kind of swore from there. Once getting into chiropractic school, it was like mind blown of like, oh my God, there's so much more. And all my questions are being answered now because this is all nervous system based. And then once going into chiropractic school, I found the technique that I really found a passion for. It's called BGI, Biogeometric Integration. And then chiropractic school being more for us to be able to pass the boards. And this really dove deeper into getting really nitty gritty into how the body is fully connected through a tensegrity model, that being where the body is made of an integrity and a tension base. So integrity, if we want to think of like the skeletal system, our structure, tension being within our ligaments, our soft tissue, our fascia, which is a very fascinating topic. I feel like I could talk all day about just the fascia, and then our muscular system. So looking through like a tensegrity model really expanded my view of like, we're not just here in chiropractic school to rack and crack, as they like to say, or the flying seven. We're really impacting how we're operating at a very cellular basis. So every day is a learning day. Find it very passionate, and getting to speak on it is very influential. So yeah, that's how I kind of got into it, and I'm thoroughly enjoying it.
I love that. When it comes to your specialty, you mentioned your technique, but what do you specialize in as far as like a certain area of chiropractic or patients that you like to serve?
Yes. So love working with all populations, understanding the body from a tensegrity model. It really opened up to my eyes that I can really help anyone that walks in the door, regardless of symptoms, or somebody that is just trying to help themselves emotionally regulate. So it was my mentor through BGI that really opened up my lens of helping women with the pelvic floor. She kind of guided me saying, I could really see you working with women specialized in women. And that's when I found GynoChiro. So gynecology for chiropractic. That is what I wish to really spend majority of my days working with women for that type of service, on top of traditional chiropractic care, just because I just enjoy it, love it, especially when working with families. Whatever the dynamic is, I wish to come into your household and really influence the whole house. But the GynoChiro is founded by Dr. Danielle Cornelius. She's up in Oregon, but she had a fascination for fascia before going to chiropractic school. Going into chiropractic school really opened up her eyes, how we're really misinformed of its purpose. So I've been in that for about 3.5 to 4 years, and now offering it in this area, GynoChiro, and it's all to do with the pelvic floor. So it is external work as well as internal, and we really are focused on the fascia within the pelvic floor. But as we know, the nervous system is operating for the whole body as one unit. So it's just not focused on the pelvic floor. We're also including the abdominal area. So really creating opening for the diaphragm to create breath. Breath is very important when it comes to the nervous system and regulation. So doing nice abdominal massages to open all of this area so that we can really get deep into the pelvic floor and work with the fascia. The fascia holds a lot of stories, as we hear, a lot of emotions, and a lot of patterns. So when we're in our mom's womb, that's when our mind map starts to be cultivated, where we have these neural circuits happening, we're wiring and firing, and primitive reflexes are a huge topic within neurology. It's the groundwork of what's really creating that mind map. So if we're ignoring the pelvic floor, which is a direct indication to how the nervous system is operating, the fascia within the pelvic floor, if it's causing restrictions, patterns are being held there, but we're not addressing it one-on-one, we're kind of on an external level, we can't really go deep as much as is needed sometimes. Symptoms are still presenting, whether it's infertility, hormone imbalance, just chronic pain. We don't want to be doing more harm to the body by constantly adjusting, whereas the issue is really lying within the pelvic floor. So, as well as the external abdominal massage, we get internal, and we really work with the fascia, really creating gentle massage and opening so that we can get that breath down into that area. And it could be involved with traditional chiropractic care too, but we really want to highlight the pelvic floor, the care of it, the nurturing of it, and just really addressing it from the inside out.
Interesting. So, how does it when there's would you call it pelvic floor dysfunction then?
Yeah.
Okay. When there is pelvic floor dysfunction, how does that express?
So how the body talks to us through symptoms. So if we are having hormone imbalances, if our cycle is irregular, chronic pain that has been presented for quite a bit of time within the hips or deep within, if there's pain with sex, intercourse, if there's pain after pregnancy, all addressing the pelvic floor. Other areas being mainly with us are our biology as women. Anything that is having to do with our health and our history, especially as we have more autoimmune diseases. Our immune system is really chronically not being cared for, and this is an area that holds a lot of space. And if we're not addressing it down here, it's a direct influence to our digestive tract, so those with digestive issues, but also, as we know, with autoimmune diseases, is really correlated a lot to our digestive system. So a lot of symptoms that can go unanswered from just working on the outside of the body can be addressed from the inside, and a lot of time that's exactly what is needed.
What does it look like when someone comes to you? What does that process look like for you?
It's really depending on the individual themselves. If they feel comfortable with starting internal work, this is a space that is very vulnerable, and especially if trauma has been in their history, we want to take it very cautiously and just time oriented to when they feel most comfortable. We really focus on three different pillars for a nervous system: that's coordinating health, adapting, and being resilient. Those three being, and I'll get back into it more, but just kind of taking a moment here of like movement, nourishment, and connection. So movement, we really need the body to have a certain amount of diversity in movement, that being strength training, resistance training, especially with us, with our cycles, with our specific hormones to us, we really have to highlight resistance training for our bone health. That could be a whole nother topic too. Estrogen, progesterone, keeping our bones really strong to keep our body really upright, strength, how much it's influential to our cognitive function. So within the movement, strength training, resistance training, a fascia lengthening. So we could think of yoga or Pilates, but also like really slow, intuitive movement so that we can get deep within the body and allow the nervous system to understand that we're safe and comfortable at this certain length, which is teaching the fascia to talk to the nervous system and to keep us at a baseline. And cardio. We just need cardio for the cardiovascular factor, our respiratory, to get the blood flowing. So whatever that may be, if it's just casually walking, that's perfect. We're getting our steps in. So having that pillar of movement, incorporating those three, is really helping keep the baseline for that individual receiving this type of care, and just in general overall health and wellness. The nourishment aspect is really going to highlight our nutrients, how important our diet is, and I hate using the word diet because it shouldn't be a restriction. Our food, how are we nourishing our body with our nutrients? So protein being a huge important factor, building blocks to our genetic makeup. on top of every other chemical compound in our body. Carbs and fats, especially for us females, we should be keeping our protein at the same amount, regardless of where we're at in our cycle. So a gram of protein per body weight, regardless where we're at within our cycle, and then we're fluctuating with our carbs and fats depending where we are, so it can really help maintain our hormone levels. But also we've got to think about our micronutrients, so our vitamins and minerals. These are just as important because these also are building blocks to the chemical compounds in our body. We need to hydrate. Hydration is very crucial. If we have electrolytes, lemon added to our water. Hydration also for our fascia. Protein being a huge influence to the hydration of the fascia. Sleep. Can't talk about sleep enough. We need the rest and the recovery. Sunlight, that's a huge factor, really help our circadian rhythm like you mentioned, and our infradian rhythm, with us females having that 28 to 31 day cycle on top of the circadian rhythm. So biologically,
Talk more about that. What is it called?
the infradian rhythm or cycle. So it's how we're operating within our menstrual cycle. So it's a 28 to 31 day cycle, depending how long our menstrual cycle runs. For us, we're all individual. As much as we are similar, we're all very different. We want to ensure that we're getting our cycle every 28 to 31 days so that we can really allow our body to detox, get rid of, create space and opening. This area is not just as beautiful and incredible as creating a baby is. This area in general is just the creation of life. So how are we being creative as humans and as individuals? So having the infradian rhythm is really important to ensure our menstrual cycle is in rhythm with ourselves. So it's very important as much as the circadian rhythm, and it's why we as women really need to be honoring that because it's within our biology. Just like how our cells are having to die off, we have many different cells that are on different time spans, lifespans. It's the same thing with the uterus too. We need to be shedding those cells, and that's the downfall of the blood at the menstrual cycle, is the getting rid of, creating space, creating fresh vibrations and oxygenation within ourselves from the inside out. So infradian rhythm is really important as much as the circadian.
And what is supporting that rhythm look like on a day-to-day basis for women?
So doing the three pillars, so the movement, the nourishment, and then going into the connection being really ensuring that you have a community that's supportive, whether that's social life, family life, friends, career, whatever your environment is, really ensuring that you're becoming aware with yourself of what makes you excited, passionate, and having those around you support that dream and that vision that you have so that it can come to fruition. And this area is exactly the space that I like to say it's like our vision board. What do we want on there so that we can really cultivate and create that? We also want to be ensuring that we are doing some form of breath work, which is really helping with the connection and meditation so that we can really slow us down. And within the infradian rhythm, there are certain areas within our menstrual cycle that we feel that deeper call inside. It's mainly within our luteal phase where we kind of feel reserved and not isolated, but we want to take ourselves out of the picture and be more so with ourselves. That's a lot of wisdom within that and the ability to connect deeper to things that we are questioning in the external world, but yet our answers are deep within. So connection-wise, using breath work and meditation as a tool and within the pillar to really support yourself. Body work is really important. I'm obviously going to suggest chiropractic care because of how impactful it is directly to the nervous system. It's a bottom-up effect biologically. So we're creating connection within the body from bottom to then signal and target the brain, our central nervous system, and spinal cord. And I also like to say therapy is just as important too because that's a top-down effect. So a lot of people say, I just feel so much, but they can't put into words. That's exactly why we need the support of a therapist to help create the organization, the structure within the thinking, the cognitive brain to then help the body itself, the emotional body. So I say those three pillars is a way to really nourish and just really help one to create organization and structure to ensure that we are too being cared for rather than us putting so much energy out. We too are calling back in and receiving it. It's crucial.
That's interesting. I've explored the different phases of a woman's cycle, but I've never conceived luteal phase in that way. I'm just like, this is just when I get angsty and like everyone get away from me. But now you give sort of meaning to it, and it's just like I don't need to make so much judgment of it.
I too, there are days that I can feel that deeply. And that's like a recognition of like, oh, all right, let's check ourselves. We need to go sit outside for 5 minutes by ourselves, or we need to put our feet in the grass and just, we always talk about antioxidants from fruits and foods that we eat, but there's so much free absorption that we can get from just putting our feet in the grass. It's doing the same exact thing. It's just ensuring that we're creating stability within ourselves on a molecular level, quantum physics wise. It's very important to be receiving those the free electrons from the body so that we are not creating the oxidative stress within us, which just leads to more inflammation. A lot of things are happening on a chemical level, and taking a little time to ensure that you're nourishing that by just putting your feet in the grass or putting your feet in the water and taking a moment to like say, I'm clearing myself, is really important, especially during the luteal phase. And it's funny to start doing that and then to realize like in a couple of months to be aware of how your luteal phase has changed. It's become more soft and more harmonious with yourself, to be like, oh, I've noticed something's happening upstairs. This is my time that I need to not step away from life, but like turn more inward rather than doing so much outward.
I love that. And then for the other phases, how do you address those?
So our energy is a huge factor of what we can focus in on. So within our in our energy is a direct reflection of our hormones. So within the menstrual phase, which is the very first part of our cycle, is our time to kind of slow down a little bit also, because this is our time of detoxing. There are times that myself included, I will feel like this surge of energy just because of how much downtime I needed for my luteal phase, that it's like, oh my God, like life is back within me and this is so grand, like this is what I'm doing and this is why I'm here. So really listening to your energy. So whether that is like we're transitioning into the menstrual phase from the luteal, if our energy's still kind of low, ensuring that we're still doing movement. So even that if we want to take time to go into our resistance training or our strength training, 3-pound dumbbells can do wonders. We don't have to push ourselves. Really honor that and you will feel the difference within. So ensuring that we're getting movement throughout the cycles, menstrual cycle, kind of bring our energy levels back. So if we feel comfortable enough, picking up a few pounds of weight, doing really intuitive movement still so that we still are connecting to our body, and a lot of focus on the abdominal muscles so that we can create a lot of rotation and help with the downfall of the of our cycle. So almost thinking of like wringing out a towel, we're doing that within our digestive tract. So I love using very light dumbbells and just doing a lot of forms of rotations, very slow and intuitive. And I noticed a huge difference in my energy afterwards because I moved a lot of stagnant energy down and out. Nourishment, always keeping our protein very equal throughout the phases. But this is the time that I feel that, and science backs too, our energy is coming back. But if we want to look at this as winter time, because the cycles kind of represent our seasons. So menstrual cycle being our winter time, we're looking for more of like nourishing, warm substances. So I like to do a lot of soup. I don't feel like always making soup, so there's a brand that I really like. I don't get anything from this, but Amy's Organic Soup. And it's like lentils, vegetables. There's a lot of different types, but just so that I know I'm getting a lot of micronutrients, minerals, and vitamins within the vegetables, as well I'm adding extra protein in. So whatever that is, ground chicken, ground turkey, a clean type of red meat. So really looking at as your winter phase. Going into our follicular phase, it's spring. So today is the first day of spring. So happy spring. Yes, it's very rejuvenating. So this is our springtime. So we can really kind of, being in Florida, which is so beautiful and nice, the sun is out more, things are coming, blooming. So movement wise, we can increase our energy a bit more. So if we want to go a little bit heavier in the gym, if we want to pick up the 5 pounds, the 10 pounds rather than the 3, we can go a little bit, push ourselves a bit more. And we will feel ourselves that we have an extended amount of energy to output, because we do. We have our FSH, our follicular stimulating hormone within our pituitary, increasing our estrogen. So we're going to notice cognitively we're up and more alert and focused, and our to-do list is very accurate, and we're able to cross things off a little bit more. We're not forgetting things. So within the springtime, we can think of spring food. So adding a little bit more vegetables in, a complex carb, so it's not breaking down straight into sugar, but it's having nutrients to itself, and then a little bit of fat is included. Going into our ovulation phase is our summer, so increase of energy, the sun is beaming, we're beaming from the inside out. It's our time to really socialize. So once again, we can notice our energy levels have increased, and we also have testosterone within our blood. So this is our one time that we can go really heavy in the gym, because we have that support of testosterone. I myself have spent times of pushing myself in other phases of the cycle, and I have noticed a huge decline when my luteal and menstrual cycle come. So I'm never limiting anybody. All I see is potential in everybody. But biologically, it would be more beneficial if this is our time that we really push ourselves in the gym, strength-wise. So with the testosterone, with the increase of estrogen, but we also have a surge of our LH, luteinizing hormone. And this is going to increase progesterone for us down the road into our, now words are not coming to me, luteal phase. So as we are having the surge of the LH for the progesterone, we have the increase of testosterone and our estrogen. A lot is being felt, a lot of good emotions, good feelings are flowing through us. So energy increases, we can increase our ability in the gym. And then food-wise, it's summertime, so we want to keep with our protein. We have carbs and fats, and we want to increase fats just a little bit more so they could help us within the approaching phase of our luteal. So our luteal is our fall time. I say it's our scary time, trick or treat, like this is our time. And it's our sweater weather because of progesterone, even though progesterone increases our body temperature. This is our time to like turn inward, like put our hood on, like don't talk to me. So this is our very important phase to be intuitive with our movement. What is our body really called for? Sometimes that is put your hood on, let's go lift some heavy weight, but let's just ensure that we're balancing that out with then a nice meditation or deep connection to ourselves, whether that's a yin yoga to follow, where we're slowing down in movement and taking our breath to really go inside deeply. And then food-wise, we want to increase fat slightly to support ourselves. Carbs are going to be crucial, primarily in this phase, just to help with the extra energy that's being used to downflow within our menstrual cycle. So I know that was a lot, but looking at the cycle through seasons is really helpful. As much as I like creativity and spontaneous activity throughout my life, structure and organization is crucial, especially for our nervous system. As intelligent we are, our bodies are processes as a whole piece, and having structure and organization for those processes is really beneficial for us overall.
Yeah, no, I love that. I did not really become more aware of the phases of my cycle, but within like the last year. And I feel like once I did, I was like, oh, this explains why I feel like this when I'm pushing my body so hard. I love that. So what percentage of the patients that come see you are aware of these different phases of the feminine cycle, and how does that factor into their treatment, and what do you notice when they start to more embrace these different aspects of their cycle and diet and all that kind of stuff?
Hmm. Um, I feel like it's definitely a little bit more known. I never had the realization of how similar it was to the seasons until coming into GynoChiro. GynoChiro really highlights how the cycles of where we're living, of how Earth itself tends and cares to ourselves, happens to us too. And it's kind of silly because we kind of forget like we too are just like organic matter. We were created from an egg and a sperm, and we populated from one little egg into trillions of cells now. Um, so it's really interesting to myself included, not having the thought of like, oh, like my cycle is so important and it's a part of me and I should not be hating it. I think that's the one thing that I've noticed of people coming in, of like how we really have, trying to think of a word, of just not tended to ourselves and put a lot of and harm in like the form of like shame, emotions, thoughts to our cycle, and how it limits us, where it's actually our ability to create potential. So always mentioning like where are you at within your cycle when somebody comes in, and them giving me where they're at, whether they aren't too sure because we're not tracking it, or they are tracking it. And before they tell me, I'm like working on them, and I'm like, your body feels very water like, which is very like fluid, not like we have inflammation, but like where our nervous system doesn't want much input, it just wants a little bit of tender and care and to make recognition of it. So usually within there, I'm like, your body feels very watery. Do you happen to be within your luteal phase, or like, are you coming into your menstrual or coming out of your menstrual? And usually that is where they're at within their cycle, just because of how their body feels. Which is very cool because it creates like this rapport between us of like, this is what I'm feeling. And from what you're saying to me, like, if you're not tracking, like, now this tracks. Like, I believe we're in this part of the cycle, and really highlighting how important it is to keep ourselves accountable and to track, so that we can just create that deeper connection to ourselves and communication wise. And giving highlights of like, okay, so if our energy is really low, like after this adjustment, why don't we go home and we just journal? Why don't we just go home and light a candle, and kind of like whatever's bothering our mind, put it down on paper, and see the candle as the ability to transmute this energy, and we're letting it go, and we're creating space for what we're now calling in. Um, Also tying in like the cycles that mentioned before, like the moon cycle within GynoChiro, we really highlight like how the effect of the moon is to the water, as we can see, but it really affects us too because of how much of a water substance we are, how much fluid composition we have within ourselves, and it's really influential to how we function overall. So, okay, we're feeling a little off. We're not so within our luteal or menstrual phase, but let's look at the moon and let's see where it's at. Oh, how crazy. It's a full moon. So maybe we feel a little heightened, and we just need to take time to really do a full moon journal meditation. So, really, ways that we can just really help ourselves and create a form of connection deeper within, of like putting awareness to our thoughts and feelings and making sense of it.
Yeah, talk to me more about how the moon influences us.
So, it's very looking at it from a science perspective, quantum physics. There's a lot around us that we cannot see, but we know that we're sitting here breathing, but yet we can't see oxygen. So it's a matter of that. The energy that the moon is cultivating and pulling in, and really having a direct effect to the energy at whole, is really going to then influence our self at a molecular level. So it does sound woo-woo, but it's not. It's a quantum physics understanding. There's so much more that I also don't understand, but the more we're understanding within the quantum realm is really reassuring and just reinstating how in sync that we should be to our what's around us. So like within our our circadian rhythm, how important it is to get in sync with the sun, but why is it then not as important to get in sync with the moon too?
That is very fair and makes a lot of sense, actually, now that you put it that way.
And it's very
Interesting.
interesting of how we used to track our cycles by the phases of the moon way in the back days, our ancestries, and how we've tracked pregnancies too. So it's kind of like going back to the basics and bringing it forward. So it's not woo woo. Our lineage has done it as well. And it's just very honoring. Incorporating that into my own practice has been really softening overall.
I love that. So, in the interest of continuing with the theme of everything around us influencing us, I want to get into some discussion on women's hormones and how external, internal factors impact all of that. What are your thoughts?
Love that. Influence us dramatically. We can blame our hormones and our genes, but it truly is the environment that is influencing both those factors. We have what's called epigenetics. So epi meaning on top, and that sits on top of the gene, and that gene expresses a certain expression. And so, if we are changing the environment, inside primarily and outside being influential, but if we're really working on the inside factor, we are then changing the expression of that gene by turning a gene on or off. Not necessarily like on and off, but in a different expression overall. That being said, that influences everything. That influences our immune system, that influences our hormone levels. So if we want to then, how it influences our immune system is then how does the regeneration of our certain cells so that we are combating certain sickness, things that are happening, pathogens. If we have a nervous system that has been chronically overstimulated with cortisol to where that spikes our immune system, the environment of our body is under stress. That's going to change the alteration of our gene expression to then express some form of symptoms that then gives influence to a disease later down the line. So, if we want to stick on this topic, I love this question because it can go so many different ways. So I'm trying to like organize my thoughts so it can be very organized. So going back to primitive reflexes, those are foundational groundworks to how our mind map within our brain is operating. So neural connections, firing and wiring, create a map within our brain. And these primitive reflexes are to keep us safe. So we have a plantar reflex to where we stroke a baby's palm and they'll grip. And what does that do later down in life is help them grab things, bring them to us, bring food to our mouth to keep us nourished. It's a form of survival. It's teaching us fine motor skills. But sometimes we don't fully integrate and process these primitive reflexes, and that creates further symptoms down the line. A side effect of that is then a cortisol surge within our body. If we don't have a primitive reflex that gets fully integrated within us, our body has then the thought of this is our threat to ourselves. So then what does that release? Adrenaline, cortisol, stress. So the environment within ourselves is in a heightened state. That then changes our genes to express a certain disease. If we take the time to fully process that primitive reflex, we see those symptoms go away because that expression of that gene then changes. So epigenetics giving a big influence to how our health is overall expressing itself, being a direct influence to our hormones. We think of hormones primarily just being our estrogen, progesterone, but it's very much so with our thyroid, our T3, our T4, especially with us women. These primitive reflexes are so influential because if we don't have them processed and integrated, we then have that surge of adrenaline and cortisol, and us women primarily have more autoimmune diseases. So our body's on that heightened state of like something's wrong, and our immune system has to be constantly fighting itself. And it's doing more harm than good, and it's being overworked. And so our hormones take a real harsh influence to that.
Yeah. Interesting. Have you seen a lot of primitive reflex work impacting how hormone imbalances show up then?
It's very interesting. I feel like I'm working with it more and more, but kind of just getting more knowledge to it. We're taught it within school very briefly, just so that we can check for pediatrics. But it's not so it's not highlighted of like what this means down the line, what this can do to us at a educational athletic performance level, how this influences on a social level, because these primitive reflexes really create security within the brain, and when we don't have that security, that really leads to cognitive, emotional, educational decline. And I feel like today's age there is a lot more diagnoses of ADD, ADHD, and it's very interesting if we were to wanting to do more work myself, but like really put it out there of like making sure that these reflexes are being tested to really help with the symptoms being presented. Because I too, coming out of or going into chiropractic school, didn't really have the thought of these reflexes, or even knowing about these reflexes, could have such an effect, or could have had such an effect to myself. School was very difficult for me, so I felt like I really had to try a lot harder than a lot of my peers. Being taken out of class, going to speech class till I was in middle school, a lot of learning, all to having a learning disability. And then going through chiropractic school, and the amount of intense education that we are being kind of thrown into, and the amount of course load that we had in school, it was a lot for me. But I definitely can say having the chiropractic care in school certainly helped, and that is foundational to the primitive reflexes. An adjustment helps create neuroplasticity, so the new wiring and firing within the brain. And so I can put like my right hand up and be like, I know for a fact that certainly did a factor on my education for sure.
Wow. So what are there specific reflexes that unintegrated or disintegrated, I'm not sure which one you would say, are connected to learning disabilities then? Like which ones?
There's a lot. So we were taught 8 specific ones. There are a few more. We're born with all of them. And at certain time milestones, at 4 months, 6 months, 8 months, some of these, they're to go away. They're to be fully processed, integrated, and they show they won't present themselves anymore. There's overlap between a lot of them. So it's a factor of going through them all and then ensuring that they're not presenting. If they are, then there's very easy exercises to do. But the thing is consistency with those. We need the wiring and the firing within the brain, so it's homework for them to do at home. To ensure, and it's a process of coming in, let's check to see how it's doing, and we'll go from there.
Primitive reflex therapy is like physical therapy in a way of like, do exercises or?
Yeah, exercises. So the plantar reflex, the exercise for that is to get a medicine ball, to grip it, and then you take away your fingers and then you reconnect, and then you go through that, and you do that about 5 times, 3 times a day. So it's a matter of making that fine motor control exercise so that we can really install that. It's hard to do like as you're watching. To really do consistent so that we're getting those patterns recognized and implemented within us. And there's safety mechanisms. So it's very difficult at times, those exercises. It feels very out of body, but they're very easy. They can be done within 5 minutes.
What lights you up most to talk about when it comes to your patients, and what are the outcomes that most excite you as far as like how you're changing women's lives with chiropractic?
What lights me up is really them coming more into their body, feeling more comfortable with themselves and their fullest expression, just feeling more life from them. I really enjoy explaining how, like, as chiropractors, we're neurological based. We're, from a clinical view, really focused on finding subluxations within the spine, which subluxation just means below light. So where there's this force within our body that isn't shining as bright. From a clinical perspective, subluxation means two bones sitting on top of each other and misaligning, causing irritation, compression onto the spinal nerves, and causing a decrease in function then. So I really enjoy saying, like, we have these subluxations within the spine, but what symptom-wise is happening could be so much deeper than we're thinking, like we're just coming in with pain. But what exactly is causing that pain, and that's getting to the root cause. Yes, I understand that there's some form of subluxation in the spine, but let's become hyper aware of what we are doing, what we're saying that could be causing that. So going back to the fascia, or being the connected tissue. Fascia is a connected tissue that envelopes individual muscles and muscles as a whole package so that we can create synchronized movements. In our day-to-day world now, we are always moving in this one plane of motion and primarily sitting. So we decrease the ability to create movement, and it's creating restrictions within the body, and it's causing the fascia to really tighten up and influence how our muscles are moving. So whatever also is happening on a macro level is going to then influence the micro level. So what lights me up is really getting to explain, like, we're having this pain here in the shoulder, we'll say, and we'll work on that, and then they'll be like, this happened recently. I completely forgot to tell you, but whenever I would be breathing, I would wheeze. And ever since we've been working on this, like, I have no more wheezing and no more need for my inhaler. And it's like, wow, how incredible is that? Is that working on the shoulder helped relax and relieve the lungs, create space, just because we worked on the fascia within the shoulder, really opening up, creating space, letting oxygen in there, and whatever was happening on the macro level is happening on the micro. So if we want to go back into, like, that epigenetics of what's happening to our genes, like, something's presenting here, but can we imagine what's happening, like, deep within our cells, within the DNA, where our within the gene expression itself, the coding. So it really lights me up to really express, like, how chiropractic is for everybody, whether you have pain or no pain. What is your body telling us? What symptoms are presenting? And let's get straight to work, and let's remember that it's not just what happens on the table, it's what you're doing day to day. It's kind of just like yoga. You spend 30 minutes on your mat, but yoga doesn't start until you get off your mat. That's where the true practice and lessons and sometimes difficulties occur. But always remembering that you have support. Like, you are in this space, you're in this environment, and that's my true desire, is to keep working with women and create the community so that regardless of age and population, we have the tribe behind us, and we have the people that we are in need of and can just speak our language to really help one another.
Um, I feel like there's a lot of discussion between women on creating a community and having that safe place because of the importance of nervous system regulation as I've learned. What does that community look like in your eyes?
I feel like it's definitely something different from everybody. To me, that community is other practitioners so that I can reach out to them if someone is in need of extra support. I know I'm just one individual. As much as I want to like save the whole world, like I know that's not capable. And it's only we can only go far by ourselves. So a group of other practitioners and doctor just means teacher. And I hate using like, hi, I'm Dr. Gianna, because I don't wish for a title to put on a facade of any sorts. Like, I wish for you to call me whatever name you wish, and I will respond and I will be there to support you. And having other women that are like minded and wish to just create a community of us women that are feeling supported in whatever phase we are, and really being pushed to be creative, to just really get out of our comfort zone and push our limits to as much as we can. Know when to rest, know when to hustle. As much as I love to go, I know it's just as important to rest. And I really thoroughly appreciate other women telling me to do the same thing, because I can be sitting here and saying everything I say today and not do the homework myself. So it's really nice to have the accountability from other women and have that within a community. And I was born and raised here. I went away for school, and I just recently moved back this past April. And I couldn't be more grateful for the women that I've met here, and just am excited for the women that will continue.
I am also born and raised in this area, and I have this super weird belief. My boyfriend thinks that is very strange, but I have this super weird belief that like this area, that there's something about it. Like it's magic for community, and it's not the entire area, but it's like segments of it. And I'm glad to know that you also experienced that.
I believe you.
Yay!
And I'm coming into contact with, and I feel just like this encounter. Likewise, I feel like it's whatever energy you put out, you put back in, and it's a good reminder of like on the hard days, let's stay focused and intentional and mindful, and it will come back in return for sure.
Yeah, it's it blows my mind that Southwest Florida in and of itself doesn't seem like you wouldn't be like, oh yeah, that's like a wellness area. But for whatever reason, there is a massive collection of holistic wellness providers in our area. And I feel like, I mean, I've only really lived in Florida, so my reference point for it is not very good. But I feel like relative to other areas, even like large areas, that the population is really amazing and big here.
I'd have to agree. It's family and friends are here. These are my roots for sure, but I never saw myself coming back to the area. And that was something that I was concerned about, is like that feeling of magic of like we are in this reality, but like where's the subtleties of things? Where's like the conversations like these? And I was very concerned, and I've been very humbled.
To what extent would you say that women's health needs to be like supplemented, or do you understand what I'm getting at? Like, are there supplements that you would recommend? What are they? And what percentage of women's care is like just basic holistic things? And then where do we need to add in things?
I love supplements, especially when it comes to like herbs. Mm-hmm. These things have been here for centuries, and they're here for a purpose. So supplements wise, going back to hydration, electrolytes, I know that's a huge thing right now. My morning cocktail is always lemon with a little bit of Himalayan and mixed with water, just to get the digestive tract turned on. In the morning when we get up, we get a spike of cortisol, and that's turning on our sympathetic nervous system, the way of fight, flight, freeze, or fawn. Not, and it's not to describe that as a bad thing, but adrenaline is needed to get us up going and get our day started. And having that little bit of bitterness within the morning with a little bit of salt to get our the water out of ourselves, so like we get the flush of inflammation and a little bit of edema if we're feeling a little bit in our face or whatever it may be. The lemon itself is very good to turn on our parasympathetic nervous system, which is of rest, digest, stay, and play. So it helps that spike of cortisol, adrenaline, to come back to baseline. So I always recommend supplements, lemon throughout the day to help with those spikes of cortisol, especially right after we eat our blood sugar. We get those blood sugar spikes. So just incorporating some form of supplement throughout the day to help maintain our nervous system. There are a lot of supplements when it comes to like hormones, whether it's like our stress hormone, cortisol. We have ashwagandha that we talk about now. What other ones? I feel like I'd be naming a few like off the top of my head of like if we have a bacterial infection, we don't want to do so much antibiotics. Bitter melon is very good. Things along that nature that I will suggest to patients that are experiencing something and they don't wish to go the medical route, because with antibiotics, as we know, it's flushing our good gut bacteria included. So it takes a lot of repair if we are just on one form of antibiotic. And that's very aggravating in itself, like when we do have kids that are constantly on antibiotics and we haven't had the ability to really help the immune system, and chiropractic care really being like a spike for the nervous system or for the immune system with just one adjustment. So supplement wise, I always go to the herbs, to seasonings to help with when we are within different phases of our cycle, to help with our hormones. So yeah, I feel like I'd like to just keep it at that. If that's okay.
We could talk for hours and hours and hours.
If you want to go into parasites, fungi, all of that. Herbs and supplements are a huge form of remedies that we could turn to if we don't wish to go into the medical route. And that's needed at times. I don't wish to put any downplay on it or any down talk on that side. That's necessary and needed at times for sure.
I feel like that's just like the balance of it has been such a touch point in so many of my discussions with people.
I would like to say one thing, sorry. Yeah. Collagen. If I were to say one supplement, I would really like to highlight collagen. Yes. A very important protein. Our fascia is made of collagen, elastin, hyaluronic acid, and other properties. Like I had mentioned, protein consumption, getting at least 1 gram of protein per body for your body weight is very crucial, and ensuring some of that is from a collagen supplement would be very beneficial for our skin. From our skin to our fascia to our bone health, very necessary. So if there was a supplement, I would really highlight collagen.
What's your favorite whey? I feel like there's so many. Like I've got gummies. I've got a powder that's from like bovine colostrum. I've got like bone broth. I've got like eating meat off a bone. What's your favorite whey?
Meat off the bone during your luteal phase and your menstrual, because that's always fun. But collagen wise, I really do enjoy getting it from like bone broth. Once again, I do not get anything from this, but Ancient Nutrition, he is a chiropractor himself and has created the whole line, and I have found great benefit from going and turning to their supplements, and I do recommend those supplements to some of my patients. And I myself take the turmeric bone broth of collagen. It's very earthy, but you get used to it, and the turmeric itself is another great supplement to help with inflammation. It has really helped with my skin complexion. Having hormone issues myself, acne was a huge symptom of that. And I feel like the turmeric bone broth collagen had certainly helped.
Interesting. Okay. Is it like a package of broth, actual?
It's a powder.
Oh, cool.
So it comes in a tub and it's a scoop, and I do that once a day, and that is 20 grams of protein. And I love to do that in the morning, really trying to increase my protein in the morning. And then as the day continues, ensuring that I have it within every meal, but morning wise, making sure that my most consumption of protein overall throughout my whole day is in the morning, just to jumpstart my day, get my metabolism right, and to and you feel a difference for sure.
You really do. I've been doing that the last couple of weeks, and I'm so much more like just like even. I don't get like hangry and like
Yeah.
your like top supplementation recommendations and hacks.
Certainly collagen. I don't know if you want to call this like a supplement, but I would say food wise, ensuring pre-probiotics and fiber supplements, yes. Fiber being its own source, but pre and probiotic supplement wise, that is going to help the whole digestive tract. And just ensure that we have good gut bacteria, which is then going to influence our cognitive and emotional state. So if I were to make 5, I would say collagen, pre-probiotics, fiber, and then turmeric. Turmeric is a great supplement. Turmeric, ginger, if we want to go off more than just 5. Like I said, it can go on and on and on. But really ensuring that the pre and probiotics with the fibers included for our digestive health, which is influencing everything else.
Cool. What approach do you take when it comes to educating people on the importance of supplements like this, on micronutrients and things like that? Like if someone just doesn't really know anything, like where do you start with them?
Always asking what their day-to-day meals look like. Really highlighting how let's start to try to implement a bit more protein into each meal. What type of carb source are we eating? We want to ensure that it's not spiking our sugar too much. Fats, where are our fats coming from? Making sure that there's a balance between like the omegas 3s and 6s. So really giving guidance towards let's really create organization here. Protein, what is our source of protein? Carb, what is our source of carb? Fat, what is our source of fat? And making sure that they are clean and they're beneficial overall. And then they're making sure that primarily they're whole sources, not just something from a bag. Once again, making sure we have the remembrance of our body is organic. We can't expect it to use anything that is synthetic processed. Can't pull any form of nourishment, nutrients from that. And then when it comes to the vitamin and minerals, when we are in need of supplements to help with that, making sure it's bioavailable so that it's actually being absorbed within our gut, so that we're actually taking those and using them for the processes that those vitamins and minerals are needed for.
Okay, cool. And then, okay, so one last question. What about like women taking peptides?
I say it depends on what we've done to try to help ourselves with what symptoms are at hand. Let's always try to do natural before anything synthetic, man-made.
What would you tell people that go to quick fixes when it comes to their health over those foundational things?
You're just going to find yourself right where you started, and that's going to be frustrating and aggravating, and you're going to feel like it just doesn't work and that we're at a loss. I understand, like, going back to those three pillars of movement, nourishment, and connection. That's a lot to look and ensure that you're doing for your day, for yourself, day to day, as well as your household. But that's what's going to keep the consistency and the nervous system adaptable, coordinating your health, and really being intentional with what we're trying to change and alter. So those quick fixes are exactly as it is. It's a quick fix, but you're going to have to do another quick fix very quickly. So,
What is your, I'm sorry, we're over time, but I'm just keeping asking you questions because they keep popping in my head. What is your like, your one thing you're like, you wake up and you have to do this beyond the lemon? I know we talked about that one, but like, what's your go-to habit that's like, this is what you have to do every single morning?
I appreciate you asking that because that's very easy to answer. Movement. I have to do some form of movement. I'm very passionate about movement. That helped me extremely. Mental, emotional, stress levels. Without movement, we have no life expression. And once we stop moving, there is no expression at all. So that really helps me just keep myself in alignment of what is my intention for today, what is my schedule like, and ensuring that we're going in with our purpose and the highest version of ourselves. And movement is the way to get our endorphins going. No matter if we're having a bad day or good day, making sure that you're moving will certainly help with the how we're just feeling overall. So movement is my one thing necessary before my lemon water. I know that I will do better if I just get my movement in, and then I come in and I make my lemon water with my salt.
Yes. What is your movement of preference?
Yes, preference depends what day I'm having.
That's true, and maybe
so-
cycle too.
Correct. Exactly. Yes.
Like you
Absolutely.
said.
I do a blend of Pilates, yoga, and strength training. Once getting into the gym, when I was 16, I was very bodybuilder. I went through a prep. School got too much for me. I wasn't eating as nearly as much carbs than I needed, and I totally had an effect to my cognitive health. And I stepped away from competing and focused on my bachelor's program, and felt so much better afterwards. When COVID happened, I stepped away from the gym and I did a year of just yoga, and I actually had never felt any better. I didn't realize how much I was in need of that. So then after moving over here, I kind of found more of Pilates, and I did months of just Pilates. So I kind of go like full in on one form of movement, and now we are balanced. As I said, with the pillar, we need some form of strength training, resistance training, and it helps me just remember strength training helps me with just confidence. Imposter syndrome is a real thing. So I appreciate you asking me these questions and overcoming being on camera. So thank you. But strength training certainly helping me with that. Some form of Pilates throughout the week, and yoga and breath work, depending on where I'm at within my cycle. And I usually try to keep myself routine and structured to a week-to-week plan until I'm like, I need to switch this up.
I feel that. Routine helps me stay consistent with anything, and movement for me from a mental health perspective is everything. What final thought or word do you have for people that are struggling to find their way into wellness?
Just keep on looking. Like, whatever draws your attention, go all in on it. And if support is something you're in need of, like, hello, I'm here. I'd love to help, even if it's just a word of advice. My word of advice is just keep at it, keep consistent. Nervous system regulation. Just looking up nervous system regulation and seeing what draws your attention. I enjoy doing that sometimes. Like, what am I in need of today, movement wise, and just seeing what draws my attention and trusting myself of like, okay, this is what my body's asking for. And then realizing afterwards, like, wow, I actually really did need that. And that really helps build a trust within yourself. And I think that's very important in itself too. Wellness is individual for everybody, so everyone's journey is very unique. And so we can look to each other for guidance and such, but the true answers are deep within, and just connecting with yourself is the most important thing.
I love that. Thank you so much.
Thank you. Thank you.